It's covered with soft tissue, but you can see I cannot dent it with the pointing stick. And posteriorly you have the soft palate, which that does have a lot of give when I press on it. This is obviously the tongue. Note that the tongue papillae in the cat are keratinized. They're like tiny hooks. So cats actually use their tongue as a comb, as I'm sure. Do we have any cat owners here?
Yep.
So you know the cat licks itself, and as it does so, it actually combs the loose hairs that have fallen out from its fur with these keratinous papillae, and then it swallows them and then coughs them out as a disgusting hairball. So, moving along, this is the larynx or voice box. You see this flap here? This is the epiglottis, which covers the glottis, the opening of the larynx during swallowing. These are the internal nares, the posterior opening of the nasal cavity. So here we have the trachea. You can clearly see the cartilaginous rings that support it. And running parallel to the trachea are the two arteries, which are, anyone? What arteries run within the two big arteries in the neck? In the neck. Carotid, specifically common carotids. So you can, sorry, you can also clearly see the white cord. That's the vagus nerve or cranial nerve number 10. It lies right next to the common carotid on each side. There is also the internal jugular, but remember in the cat it's very small. So during the end, ideally it was supposed to get injection of blue latex, but it didn't get it. And as I was dissecting the cat, I guess I must have accidentally destroyed the internal jugular vein. But the external jugular is hard to miss. Here it is, the external jugular. You can possibly see anything from over there. Miss McNeil, you should really come over to this side of the table.
There's nowhere I could.
It's hard to see from...
Okay, never mind
I
then.
can see what you're pointing to.
Okay, here is the external jugular. On the other side, again, passes over the sternomastoid muscle. This is the the right subclavian. Actually, this is the right subclavian vein and artery. They are about to become the axillary vein and artery. So the subclavian vein joins with the two jugulars, the external and the internal, and forms these two veins, which are called the two veins that drain into the superior vena cava. Anyone? These two veins? Again, they receive drainage from subclavian and the external and internal jugulars. So what are these two veins? Anyone? These are brachiocephalic veins, people. If you remember your regional terminology, it will be much easier for you, because brachial means brachium, the upper arm. Cephalic means pertaining to the head. They receive drainage from the head and from the forelimb. So brachiocephalic veins. And this is the pre-cava. Again, I will accept superior vena cava for the cat, just to simplify things. So this is obviously the heart. Here you have the right and the left auricles. This is one of the lungs. I have removed some of the other lung to expose the structures. Again, the injection did not quite go to plan, meaning this is the aortic arch here. Unfortunately, it's colorless. It didn't get much of the red latex, but this here is the aortic arch. Aortic arch, and it has two branches in the cat. This is the brachiocephalic trunk, which then gives rise to the two common carotids and to the right subclavian artery, and this here is the left subclavian artery, which separately branches from the aortic arch. Okay, so let's see. Here we have a big sheet of skeletal muscle, which is, anyone? The sheet of skeletal muscle that separates the thoracic cavity from the abdominal cavity.
Diaphragm?
The diaphragm. Now here we have a couple of major nerves. One of these is the vagus nerve. This is the vagus nerve, and it innervates the heart. When vagus nerve is stimulated, what happens to the heart rate?
Go out.
Exactly, because it's part of, it contains the pathways of the parasympathetic division of the autonomic nervous system. So this is the vagus nerve, and the other, and actually, pardon me, I stand corrected. Remember I told you that the vagus nerve runs right next to the common carotid. This is the vagus nerve, because when I tug on it, see, when I tug on it, there is movement here. So I'm sorry, this is the vagus nerve. This is the vagus nerve. And the other nerve, which bypasses the heart and goes all the way to the diaphragm, is called the phrenic nerve. Do you remember if your lecture instructor mentioned it when covering the peripheral nervous system? Yes, no, maybe?
No.
Okay, well, that's very, very surprising, because phrenic nerve is kind of important, especially with people with spinal cord injuries, because phrenic nerve originates in the cervical plexus, which basically is made up of several cervical nerves, and then from this plexus arises, surely the lecture instructor covered the plexuses, the cervical, the brachial, the lumbosacral.
Yeah.
Okay, well, again, the phrenic nerve originates from the cervical plexus. So suppose a person has spinal cord injury in the cervical region. That person becomes, anyone? Paralyzed. What's the term for a person who has both upper and lower limbs paralyzed? Does anyone know? Say again? Para is only legs. It's quadriplegic. So a person becomes quadriplegic, but here how much he or she will depend on the respirator depends where in the neck the spinal cord is severed. So what what are the muscles? Okay, you haven't started the respiratory system in lecture, correct?
No.
Okay, well then I'll tell you this. When you breathe in at rest, you use the diaphragm plus the external intercostals. Now, again, I can't vouch for your 301 lecture instructor. Did he or she cover the structures innervated by the spinal nerve? So, for example, ventral rami of thoracic nerves, what do they innervate? Anyone? Okay, well, they innervate. Now, this segment of the digestive tract is, think about it, J-shaped structure.
Is that the stomach?
Stomach, exactly. This is the stomach. Here you have the small intestine, the large intestine, and here, this enormous thing is actually the spleen. So in the cat, it's much larger. And this is one of the kidneys. So the spleen in the cat is huge. This, by the way, is the greater omentum, which is a fold of peritoneum that hangs over the intestines. Okay, but let's get to the blood vessels. Okay, this is obviously the inferior vena cava. This here, big blue blood vessel. Blue because it has been injected with latex. Right next to it is the abdominal aorta, which again, it got a little bit of red latex, but not nearly as much as it was supposed to. So you see, this is the abdominal aorta. Well, how about I remove my hand? So how about now? Can everyone see the abdominal aorta? Okay. So this vein and this artery, I think you can identify easily. These are, what are these? This vein and this artery. Vein, artery. This is the kidney, renal, and this, by the way, is the adrenal gland, which in the cat has a slightly different position relative to the kidney. Okay, here comes the hard part. Okay, let's see. Okay, this here is still the abdominal aorta, and coming off the abdominal aorta, again it didn't get much in the way of latex, is the celiac trunk. So this is the celiac trunk here. Abdominal aorta, celiac trunk. And this is the splenic artery. This is the spleen, this is the splenic artery. One of the branches of the celiac trunk. This is another branch of the abdominal aorta, and branches immediately posterior to the celiac trunk. This is the superior mesenteric artery, which supplies blood to the small intestine. Then, further posteriorly, you have the inferior mesenteric artery that supplies blood to the large intestine. Superior mesenteric, inferior mesenteric artery. Superior, inferior, all the way up here is the celiac trunk. Okay, what about these very thin, obliquely oriented, perhaps not as curvy as they are, or curly as they are on the model, but what about this artery and vein?
Genital?
Genital, exactly. And they're on both sides. So genital artery and vein. What about these artery and vein? They are associated with masses of fat, although I actually removed much of this fat. And they, on the model, they actually branch perpendicularly. In this particular cat, they are somewhat oblique. This artery and vein, anyone? Look at the cat model. Well, you obviously need to turn it around to look at it, most of you. So it's these branch posterior from the abdominal aorta posterior to the genital artery and vein. This artery and this vein. Anyone? No. These are iliolumbar artery and vein. Again, they're associated with masses of fat that lie posterior to the kidneys. So iliolumbar artery and vein. And finally, at the posterior end of the abdominal aorta, we have this artery. What artery is this? Know that it passes through the abdominal wall and onto the thigh. Well, when it's on the thigh, it's femoral, but while it's inside abdominal cavity, this artery is external iliac. Remember, there is no common iliac in the cat. So this is the external iliac branching from the abdominal aorta, and you can barely see the internal iliac artery, which also branches directly from the abdominal aorta. So obviously here we have femoral artery, femoral vein. And that's pretty much it. Again, kidney, this is one of the ureters. This is the urinary bladder. And this is the urethra. So urine produced in kidneys drains is drained by ureters to the urinary bladder, and then from the urinary bladder is expelled through the urethra. That's for the urinary system, which will be covered after exam number 3. Okay, so this is about it for the blood vessels on the demo.